Hello everyone, this is Mrs. Correa. Welcome to week 7 lecture, Caring for the Postpartum Women and Her Family and Care of Women with Complications of Postpartum. This week's lecture is going to be a little more longer than the usual ones. I am trying to make it short, this way I can avoid uploading issues. The topics included during this week are postpartum assessment, vital signs, fundal check, lochia, perineum, the acronyms of REDA, bubble HE, promoting recovery and self-care during puerperium, breastfeeding, nursing care of women experiencing complications during postpartum, such as postpartum hemorrhage, postpartum infections, thrombophlebitis and thrombosis, and postpartum psychosis. Early maternal assessment includes vital signs. We need to make sure the temperature is within normal limit, pulse, check for bradycardia, and tachycardia can result from difficult labor, birth, or hemorrhage. And check blood pressure, and I want you to read what can cause high blood pressure and low blood pressure during postpartum. And we also need to check respirations. Perineal assessment. Sims position to facilitate perineal assessment during immediate postpartum period. And REDA, it is R for redness, edema, ecchymosis, discharge, and approximation. We need to look for hemorrhoids and teach regarding comfort measures. If severe, teach how to manually reposition. Bubble HE is a mnemonic commonly used by nurses during the postpartum assessment. The bubble stands for breast, uterus, bladder, bowel, lochia, and episiotomy, and that HE, H stands for hormone sign and E stands for emotions. So it is used as a guide so that you can follow the steps in postpartum assessment. Assessment of breast includes checking for firmness and filling. Before feeding the baby, the breast should be firm, and then after feeding, the breast becomes soft. By touching, you can assess the firmness and also ask the mom that if the breast is soft or firm. Then check for any nodules, fissures, cracks on the nipples, or any presence of blood on the nipple. If it is there are cracks, there is a possibility. And dried milk, if the baby is breastfeeding well, you may see some part of dried milk on the nipple. And check for the nipples if it is erect or inverted. So inverted nipples will have problems with breastfeeding. Uterine assessment or fundal assessment. Immediate postpartum, the fundus will be halfway between the symphysis pubis and the umbilicus. The placental expulsion usually occurs within 15 minutes after birth. And what is involution? It is the term that describes the process whereby the uterus returns to the non-pregnant state. And what is subinvolution? It is the failure of the uterus to return to the non-pregnant stage. And 1 hour after postpartum, the uterine level will be at the level of umbilicus, then descends 1 finger breadth each day. Please remember this. And you need to assess the lochia, which is the puerperal discharge of blood, mucus, and tissue. And the fundus is not palpable after 10th postpartum day. And I want you to refer to the figures and which is listed in this slide. Assessment of bladder. Spontaneous void within 6 to 8 hours postpartum occurs. And monitor for first voiding, anticipate maternal diuresis. Urinary output may reach up to 3000 mL per day, and the urine volume and the flow returns to pre-pregnant levels within 2 to 3 days postpartum. Assessment of bowel. The mother may experience increased hunger and thirst after childbirth. And the relaxin, which is a hormone, this is increased during pregnancy, and that increased amount depresses the bowel motility, and which can lead to constipation. And the strategies for prevention of constipation are early ambulation, abundant fluids, and increase high fiber diet. Assessment of lochia. There are three types of lochia. Lochia rubra, which is the red one. I want you to find out how many days. Lochia serosa is the pinkish brownish lochia. And next one is Lochia alba, which is kind of whitish to yellowish. And we also need to document the amount of lochia. You may record it as mild, moderate, or severe. We need to assess the episiotomy site. It is a 1 to 2 inch surgical incision. The episiotomy can be a medial episiotomy or a mediolateral episiotomy. And assess for RIDA, and you know what is RIDA now. We can apply ice for the first 24 hours, moist heat and sitz bath, and dry heat and hot packs can be done later on. Assessment of deep vein thrombosis is very important. We perform Homan sign, which is dorsiflex the foot and assess for the resistance and pain. And Homan sign is performed in postpartum women. And there is a big controversy. Many medical surgical books will say, many studies will say, there is research support saying that Homan sign should not be performed because it can dislodge the thrombus formed. Instead, do an ultrasound. So this controversy you will hear in regular medical surgical floors, especially after surgery, you may not see them doing. It was interesting. I recently had a neurology clinical in pediatrics, and I had a very well-known neurologist who was my preceptor, and I saw him performing this test, and I have asked him, why do you do this? There is so much controversy. His answer was, if there is a strong suspicion, we will not do it because that can dislodge the thrombus. But depending upon the patient's condition, each patient is different, we may do the Homan sign occasionally. If it is needed, they will do it. But if there is a strong suspicion, they will not do it. So that is just to clarify on that issue. I'm explaining that point. Then we need to do the clinical assessment for erythema, unequal cuff circumference, and heat. And always remember, all the clinical signs are not always reliable. We will continue with the maternal physiological adaptations during postpartum now. I want you to read these physiological changes from your textbook on hematologic system, hormonal levels, neurological system, renal system, fluid and electrolytes, respiratory system, integumentary system, cardiovascular system, immune system, reproductive system, menstruation and ovulation, gastrointestinal system, and musculoskeletal system. These are not very hard to understand from your textbook. I am unable to explain everything because of the problem to upload with a lengthy file. Promoting recovery and self-care. I want you to read about activity, rest, nourishment, elimination, perinatal care, and after-birth pains from your textbook. Little about infant feeding choices. They are breastfeeding or formula feeding. We need to educate the parents that breastfeeding is always the best and advantages of breastfeeding. And if the parents choose to formula feed, we should agree to that and honor their request because it is their choice. We need to educate and support on breastfeeding and support on breastfeeding, and again we always honor their request and it is the parents' choice what they want to do. We are going to move on to women experiencing complications during postpartum period. We'll discuss on postpartum infections, thrombophlebitis and thrombosis, postpartum psychosis, and postpartum hemorrhage. Postpartum hemorrhage, I want you to read from my PowerPoint lecture, which has more details, and also I have explained this in detail during the simulation day, and we ran the simulation for some groups and we'll be running for the other groups in the coming weeks. So you have a lot of information on that. Please remember to read it. It is very important. You will get some questions from postpartum hemorrhage for the next exam. Thrombophlebitis and thrombosis. It is an inflammation of the venous circulation and blood clot formation that typically occur in the lower extremities. The pathophysiology DVT develops from several key factors: a hypercoagulable stage, venous stasis, and venous injury that can lead to this thrombophlebitis and thrombosis. And signs and symptoms include pain, tenderness, and sometimes it could be asymptomatic. Diagnostic tests: D-dimer, which is a product of the degradation of fibrin by the circulating enzyme plasmase, may be ordered, along with venous duplex ultrasonography and MRI can be used. Collaborative management includes use of analgesics, elevate extremity, compression stockings, devices, increase fluids, apply moist and warm pads, complete bed rest with bathroom privileges, anticoagulation therapy, and we need to have a good patient teaching for that. Measure leg circumference carefully and keep monitoring them. Puerperal infections or postpartum infections. Puerperal infections refers to bacterial infection, usually of the endometrium, that is endometritis or metritis, that occurs within 28 days after miscarriage, induced abortion, or childbirth. Types of puerperal infections are endometritis, mastitis, operative wound, and urinary tract infections. I want you to read this from your textbook. There is a table. Please focus on the risk factors, signs and symptoms, and the collaborative treatment. We need to be very careful in assessing puerperal infections because that can lead to sepsis quickly. The collaborative management of puerperal infections are antibiotics, encourage rest, increased fluids, proper nutrition, provide comfort measures, non-steroidal anti-inflammatory drugs, and educate women and their family. Postpartum psychosocial complications. These are the very important topics, and remember I always say that the first one to identify postpartum blues or postpartum depression or psychosis is the pediatrician, because they are the one seeing the mom and the baby more often compared to the midwife or the obstetric provider. The postpartum blues, they are self-limiting, and postpartum depression, the signs and symptoms are anorexia, weight loss, insomnia, fatigue, inability to concentrate, withdrawal, suicidal thoughts, excessive fears about the infant's health, negativity, agitation, then infant neglect or abuse, etc. So if one or two symptoms exist most or all of the days, then we may consider it as postpartum depression. We need to identify the risk factors and screen at postpartum visits, but I tell postpartum visits are less often compared to the newborn visit, so it may get undiagnosed or undetected by the midwife or the obstetric provider. Postpartum psychosis, that is the severe form, and the onset is within the first 8 weeks after childbirth. The distinguishing signs are hallucinations, agitation, confusion, suicidal or homicidal thoughts, delusions, and sleep disturbances. They may have loss of touch with the reality, and this definitely require hospitalization. Psychosocial postpartum nursing care. We need to teach to seek help if feeling overwhelmed, which is very important in the primipara woman or adolescent mothers, single mothers, etc. And we need to encourage rest because some babies sleep the day and they may be up the whole night. So we may have to tell the mother that they need to rest when the baby is resting too, because if they don't do that, they can get really exhausted and they may feel that it is so overwhelming. We need to support the bonding, perform holistic assessments, and advocate for home follow-up. This is especially needed in adolescent moms or some high-risk behaviors if you have noticed, or if you already know that the patient is going through postpartum blues. Few words about postpartum nursing for vulnerable population. They are victims of abuse, undocumented immigrants, limited access to care, homelessness, such as people who live in the shelters. These are very vulnerable population, and they may not seek care. They may not have enough supportive system. So this is very important that we need to extend our care to those vulnerable population, and also assessing them before they go home so that we can arrange a home visit by a visiting nurse, or we can refer to the agencies who can provide further care at their home or some evaluative visits. And that is all about week 7 lecture, and thank you for listening.